Avoid dialysis. Top 6 common drinks to cleanse and protect your kidneys. What if I told you that the most powerful tools to protect your kidneys aren't in the supplement aisle or the pharmacy? They're already in your kitchen? That morning coffee you're drinking. Research links it to a 14% lower risk of kidney disease. That pomegranate juice in your fridge? Clinical trials show it can reduce hospitalizations for dialysis patients. The disconnect is stunning. Millions of people spend hundreds on detox supplements while ignoring the science-backed drinks that actually cleanse and protect their kidneys. Today, we're fixing that. So, before we reveal our list, we're curious. What is your current go-to drink for a health boost? Let us know in the comments below. We're reading every single response. In this video, we are counting down the top 6 of these science-backed drinks that can genuinely help cleanse, protect, and fortify your kidneys. You will want to watch until the end because most people are drinking them wrong, at the wrong times, or mixing them with ingredients that cancel out the benefits. Just so you know, everything in this video is grounded in peer-reviewed research, completely free from marketing bias or miracle cure claims. We've sifted through the science so you can make smart, informed decisions about your health. Before we dive in, here's an important note. We're sharing evidence-based nutritional information, but this isn't individual medical advice. If you have diagnosed kidney disease, work closely with your nephrologist and renal dietitian. They can help you personalize these recommendations to your specific lab values and health status. 6. Water. What is the #1 job of water for your kidneys? The common answer is flushing out toxins or cleansing your system. But what if its most fundamental benefit has nothing to do with flushing at all? A 9-year study of over 3,600 people found that, compared to people drinking less than half a liter of water daily, those who drank more than 1 liter had a 21% relatively lower risk of developing high blood sugar, one of the primary drivers of kidney disease. This is a relative risk reduction, meaning if the baseline risk was 10%, it might drop to about 7.9%. How does plain water accomplish this? It works by calming a critical survival hormone called vasopressin, a hormone that regulates water balance. When you're dehydrated, vasopressin levels rise, signaling your kidneys to retain more water. While this is a normal response, chronically elevated vasopressin from persistent dehydration is linked with both kidney stress and metabolic changes that can affect blood sugar and blood pressure regulation, the 2 key risk factors for kidney disease. It's important to note this was an observational study showing association, not causation. People who drink more water may have other healthy habits. However, the biological mechanism is plausible and supported by multiple studies. So how much water do you need? General guidelines from the National Academy of Medicine suggest approximately 2.7 to 3.7 liters daily for adults. That's roughly 11 to 15 cups total water intake, with about 80% coming from beverages. The European Food Safety Authority has similar recommendations. But this varies based on body weight, climate, and activity level. A more practical approach many clinicians use is about 30 to 35 milliliters per kilogram of body weight. For a 70 kilogram, or 154-pound person, that's approximately 2.1 to 2.5 liters per day. But the simplest self-check? Your urine color. It should be pale yellow like lemonade, not dark like apple juice or clear like water. This isn't about following a rigid rule. It's about listening to the clear signals your own body is giving you. However, if you have a diagnosed chronic kidney disease, or CKD for short, especially stages 4 or 5, heart failure, or take diuretics, these general guidelines do not apply to you. Your kidneys may not be able to handle typical fluid volumes, and excess fluid can be dangerous, leading to swelling, breathing problems, and cardiovascular strain. In that case, the most important signals come from your doctor, as your fluid needs may be very different, so don't just follow general advice. 5. Green tea. For many of us, green tea is a familiar source of antioxidants. But recent science suggests its most profound benefit isn't just about prevention. One of green tea's key active compounds is epigallocatechin gallate, or EGCG. Research shows EGCG has two main mechanisms. It helps modulate inflammatory pathways like NF-kappa B, and it can upregulate antioxidant systems like NRF2. This means it may both reduce inflammatory signaling and support the body's natural antioxidant defenses. It doesn't just fight for your cells, it teaches them how to better fight for themselves. But does this cellular battle translate to real-world results? A 2025 landmark analysis of over 17,000 people with CKD provided a promising answer. In this study, following patients from 1999 to 2018, regular tea consumption was associated with an 11% relatively lower risk of death from all causes among people with early-stage CKD, or stages 1 to 2. To put this in perspective, if 100 people with CKD have a 20% risk of dying over 10 years, regular tea consumption might be associated with reducing that to about 17.8%. To be honest, this was observational data, so we can't be certain tea itself caused the difference. Tea drinkers may have other health protective behaviors, yet the result is still promising. And the protection doesn't stop there. Other large-scale research shows green tea also helps manage the two primary conditions that lead to kidney failure and dialysis in the first place: high blood pressure and type 2 diabetes. So how do you harness this protective power? For kidney benefits, research typically involves 2 to 3 cups daily of brewed green tea. Use water at 175 to 185 degrees Fahrenheit, or just before boiling, and steep for 2 to 3 minutes. You can use either loose leaf, about 1 teaspoon per cup, or tea bags. Note that each cup contains about 30 to 75 milligrams of caffeine. If you're caffeine sensitive or have sleep issues, drink before 2 p.m. If you take blood thinners like warfarin, green tea's vitamin K content may interact. Consult your doctor first. But there is a dangerous counterfeit to avoid: high-dose green tea extracts. That $35 bottle of concentrated green tea extract? Systematic reviews link high-dose extracts to a serious risk of liver toxicity, hospitalizations, and acute injury. The same EGCG that protects kidneys when brewed gently becomes dangerous when chemically concentrated. You can't engineer your way to health. So, skip the pills. Brew it yourself. 175 degrees Fahrenheit water, 2 to 3 minutes. It's natural, safe, and less than $10 a month. And hey, if this feels helpful so far, let us know you're out there by tapping that like button. It tells us to keep making content just like this. 4. Lemon water. Many people start our day with lemon water, thinking of it as a daily detox ritual. But this habit is much more than a wellness trend. It's a potent, science-backed strategy against one of the most painful kidney conditions. In fact, the National Kidney Foundation now explicitly recommends it to help prevent the formation of kidney stones. This protective effect comes from a natural compound called citrate. It performs 2 critical tasks in your urinary tract. First, citrate binds with calcium in the urine, forming soluble complexes that are less likely to crystallize into stones. Simultaneously, it latches onto any microscopic crystals that manage to form. This physically prevents them from growing larger and clumping together. And this isn't just theory. In a prospective randomized controlled trial following 203 patients for 2 years, fresh lemon juice supplementation, about 60 milliliters twice daily, alongside a standard diet showed promising trends toward reducing stone recurrence. Multiple studies confirm that lemon juice significantly increases the levels of citrate in urine. In one old study, lemonade therapy increased urinary citrate by 383 milligrams per day, and reduce stone formation rate from 1.00 to 0.13 stones per patient per year. In the real world, this means you're building a stronger shield against stones while also creating a stronger current to cleanse the system naturally, providing long-term peace of mind. For kidney stone prevention, mix the juice of half a fresh lemon, about 2 tablespoons or 30 milliliters, into 250 to 300 milliliters, or about 8 to 10 ounces of water. The National Kidney Foundation recommends lemon juice, about 4 fluid ounces per day mixed with water, to increase urinary citrate. Drink this 1 to 2 times daily. While citrate helps prevent calcium-based kidney stones, if you have uric acid stones or are already taking potassium citrate supplements, consult your doctor to avoid excessive citrate intake. Different stone types require different approaches, and this is important for dental health. 1. Use a straw positioned past your front teeth. 2. Don't brush teeth for 30 minutes after drinking since acid softens enamel. And 3. Rinse mouth with plain water after finishing. Since lemon juice is highly acidic, this strategy can help protect your teeth. Also, if you have GERD, stomach ulcers, or severe acid reflux, lemon water may worsen symptoms. Start with once daily and monitor. 3. Ginger tea. For centuries, we've reached for ginger tea to soothe an upset stomach. But this ancient root holds a far deeper capability: the ability to combat the silent chronic inflammation that is a key driver of kidney damage, especially for those managing diabetes or on dialysis. The active compounds in ginger, particularly gingerols and shogols, act like a tactical unit at the cellular level. They don't just fight the flames of inflammation, they jam the signal that starts the fire. By targeting the NF-kappa B pathway, a master switch for inflammation in your body, these compounds interrupt the cascade that keeps your cells in a chronic state of alert. And this healing power is confirmed by clinical research. In a 2023 randomized controlled trial with diabetic patients on dialysis, participants who received 2,000 milligrams of ginger daily for 8 weeks saw notable improvements in both kidney function markers and blood sugar control. Another 2016 trial with peritoneal dialysis patients found that 1,000 milligrams daily for 10 weeks significantly reduced triglycerides, a key risk factor for cardiovascular disease in these vulnerable patients. This shows ginger's dual ability to both ease the burden on the kidneys and address a primary root cause like blood sugar. To harness these benefits at home, the approach is straightforward. Steep fresh ginger yourself. Steep about a 1-inch slice of fresh ginger, or 1/2 teaspoon of dried ginger powder, in 1 cup of hot water for 5 to 10 minutes. You can enjoy this with meals to reduce any stomach upset. Clinical studies typically used 1 to 3 grams daily, divided into 2 to 3 servings throughout the day. But with this natural potency comes a critical responsibility. Ginger has antiplatelet effects and can increase bleeding risk. This applies to blood thinners like warfarin, antiplatelet drugs like aspirin, and even NSAIDs like ibuprofen. If you take any of these medications, never forget to speak with your doctor before using ginger regularly. And please, skip the high-dose extract capsules. Those high-potency 2,000 milligrams ginger extract supplements marketed as more effective are exactly what makes them risky. Fresh ginger tea delivers the benefits your body can safely use. Steep it yourself. Curious about the science behind it all? We've linked the studies that support everything we've shared. You'll find them down in the description box. 2. Apple cider vinegar. Countless claims surround apple cider vinegar, or ACV for short. But if we ignore the noise and focus on the highest quality science, we find its true benefit for kidney health is indirect but fundamentally important: its proven ability to help control blood sugar. Its mechanism isn't magical, it's mechanical. The acetic acid in vinegar acts as a gentle brake on your digestive system. Clinical research shows it physically slows the rate at which food leaves your stomach. This simple delay means carbohydrates are absorbed more gradually, preventing the sharp blood sugar spikes that can strain kidneys over time. And the impact of this braking action is significant. A rigorous meta-analysis pooled data from 7 clinical trials and confirmed that consistent use leads to a statistically significant drop in both fasting blood sugar and, crucially, in HbA1c. That second measure is so important because it reflects your average blood sugar over 3 months, proving this is a sustained, long-term improvement in your body's glucose management. However, this very mechanism is also what makes apple cider vinegar a significant risk for certain people. If you have gastroparesis, a condition where your stomach already has trouble emptying properly, vinegar's slowing effect can worsen your symptoms. This is a vital lesson in personalized health and why you must speak with your doctor first if you have any known digestive issues. If your doctor approves, start conservatively. Begin with just 1 teaspoon, or 5 milliliters, of raw, unfiltered apple cider vinegar diluted in a large glass of water, about 250 to 300 milliliters, or 8 to 10 ounces, taken with a meal. After 1 week with no issues, you can increase to 1 tablespoon, or 15 milliliters. Clinical studies have typically used doses ranging from 15 to 30 milliliters per day, taken with meals to reduce digestive upset. Stop immediately if you experience nausea, throat burning, or digestive pain. Like with lemon juice, use a straw when drinking ACV to protect tooth enamel and rinse your mouth after. Avoid ACV gummies, which cost $20 to $30 for 1 month's supply and contain added sugar to mask the taste. You're taking vinegar to control blood sugar while consuming 4 grams of added sugar daily. Mix it yourself. 1 tablespoon real ACV in 8 ounces water. A $4 bottle lasts 3 months. 0 sugar, full control. 1. Filtered black coffee. For decades, many believe that coffee is a risk for kidney stones. The science, however, tells a completely different and far more compelling story. While caffeine does increase urinary calcium excretion, which theoretically could promote stone formation, large prospective studies and even genetic analyses have consistently found that coffee drinkers actually have a lower risk of developing kidney stones. In fact, participants in the highest quintile of caffeine intake had a 26% lower risk of developing stones compared to those in the lowest quintile. This protective effect is largely driven by caffeine's actions in the kidneys. Caffeine acts as a diuretic, especially at higher doses. Above 300 to 360 milligrams daily, roughly 4 cups of coffee. This natural diuretic effect creates a stronger flushing action, helping to naturally cleanse the kidneys by washing away tiny mineral crystals before they can form painful stones. Research shows that caffeine intake is associated with higher urine volume and lower supersaturation for calcium oxalate and uric acid, the 2 main components of most kidney stones. And coffee's kidney protection extends far beyond stones. A massive meta-analysis of 12 studies involving over 500,000 people investigated the link between coffee and kidney health. The meta-analysis found regular coffee consumption was associated with a 14% relatively lower risk of developing CKD, with greater benefits in those drinking 2 or more cups daily. The protective effects went further. Coffee drinkers had an 18% lower risk of progressing to end-stage kidney disease and needing dialysis, and a 28% lower risk of death related to kidney disease. To maximize kidney benefits, keep it simple and keep it black. Research suggests 2 to 3 cups daily is associated with meaningful kidney protection, with each additional cup lowering CKD risk by about 3%. Making your coffee at home costs pennies per cup and delivers genuine protection. But the moment you transform it into a sugar-loaded specialty drink, you've negated the benefits. A $6 venti frappuccino with 66 grams of sugar isn't coffee. It's a milkshake masquerading as a health drink. The studies showing kidney protection examined black coffee. Not lattes, not mochas, The moment you add sugar, flavored creams, or syrups, the metabolic benefits are negated, and these add unnecessary calories. A few practical notes. Time your last cup at least 6 hours before bed to avoid sleep disruption. If you're caffeine sensitive, start with 1 cup or choose decaf. Some studies show decaf coffee also offers kidney protection, though possibly less than the caffeinated version. And if you have high cholesterol, use paper filters. Unfiltered coffee, like French press or Turkish coffee, contains cafestol, which can raise LDL cholesterol. Takeaway. Ultimately, the greatest takeaway from our journey today isn't just a list of drinks, but a new way of seeing. It's the power that comes from understanding science, allowing you to look past the health halos and make truly confident choices for your own body. And here's the beautiful irony. The most powerful versions of these drinks aren't the ones engineered in labs or sold in supplement aisles. They're the ones you make yourself, from real ingredients in your own kitchen. Black coffee brewed at home, fresh ginger steeped in hot water, tea leaves you can actually see. When you make it natural, you're not just protecting your kidneys, you're taking back control. The information in this video is for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider before making any changes to your diet or supplement routine, especially if you have kidney disease, diabetes, heart disease, or take any medications. Individual responses vary, and what's beneficial for one person may be harmful for another. Never disregard professional medical advice or delay seeking it because of something you've seen in this video. We'd love to hear from you. Which drink on our list was the biggest revelation for you? Share your thoughts in the comments below. We read every single one, and we believe that your insights help build a community where we all learn from each other's experiences. We want to thank you for being here, for listening, for having the courage to embark on this journey of discovering what truly benefits your health. A journey that isn't easy but is worth more than anything else. Hit the bell icon and turn on all notifications so you never miss a life-saving video. The sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in a good shape recently, check out the video on the screen. Here, we cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there. Stay informed, stay healthy.